and welcome to an introduction of the Estrogen Gene Test Company. I am joined by my partner and co-founder of Estrogen Gene Test Company, Dr. Joseph Veltman. My name is Stasha Hashem, and I am the founder and CEO of the Estrogen Gene Test Company. We will take you very briefly through the test itself and the physical logistics of the test, and we will have 5 more sessions where Dr. Veltman will take you through the research and process behind the test. Dr. Joseph Veltman is very pleased to be working with him. He is one of the world's leading nutrigenomic experts. He founded the Institute for Individualized Medicine 13 years ago and has probably more clinical practice with using genomics on an interventional level than most people in the world. And we're very pleased to be working with him. And without further ado, I will turn it over to Dr. Veltman.
Thank you, Stasha, and good day, everyone. It is a pleasure to be here with you. And I think because we're under somewhat of a time constraint, we're going to try to get each part of this cumulative estrogen exposure webinar covered in 10 minutes or less. So let's get started. The title today is the cumulative estrogen exposure, because we know that that's an independent risk factor for breast cancer. And we want to see how we can reduce breast cancer risk using genomic and physiological data. We know that it's important not only for your health to be informed, but also to be smart about how you use estrogens in your body. We have prestigious partners behind this research and this test.
Shall I introduce Harvard, Vanderbilt, the University of Nebraska, Johns Hopkins? There are actually dozens and dozens, if not totaling well over 100. I don't want to say hundreds, but well over 100 studies. We've put up a few of these peer-reviewed studies in our website, as well as some Estrogen Gene Test Company collated summary papers. We are working with one of the most accredited DNA labs in the United States, also located in New Mexico, where Dr. Veltman is based. They are in Las Cruces. And again, Dr. Veltman is our Chief Scientific Officer and has some of the world's best experience in using nutrigenomics.
The estrogen gene test is comprised of 6 genes, and we're evaluating 12 different alleles on those genes. Classification of the 6 genes and 12 alleles that the estrogen gene test is evaluating, we have cytochrome P450 1A1, 1B1, and 3A4. In phase 2 detoxification, we have 3 genes: catechol-O-methyltransferase, glutathione S-transferase, and its representative alleles, GST, M1, T1, and P1. And last but not least, we also are going to be looking at manganese superoxide dismutase, abbreviated MNSOD.
The Estrogen data collection is a core part of the company. And we are looking at 2 different ways of collecting data. One, every patient that signs a requisition form is asked a series of questions, and we will be looking at that aggregate test data for all of the patients who come through the Estrogen lab. The Hormonal Cancer Foundation is attempting to make Dr. Veltman's longitudinal study, which we will discuss in a few different slides later, into a much larger study whereby we're tracking women over a very long time period, hopefully with their doctor's participation. And doctors who do participate in our study will be compensated $75 per patient. The doctor's role in that study will really be to input the patient's metabolite levels after baseline metabolite levels, the interventions that were used, and then the follow-up metabolite levels over time. The pricing of the test, what we're recommending and what we will have on our website is a price of $550 in the United States. Physicians may order this test for $475 wholesale if they deliver the results themselves. If a patient orders the test directly, the patient will receive the test results from one of our certified genetic counselors or our physicians in a telephone coaching session, which is intended to send them back to their physician for follow-up, and in no way could be conceived to be a real medical appointment. Doctors who do order the cash test themselves may charge whatever they like for it, but we are suggesting a price of $550. And of course, doctors who participate in the study will be reimbursed $75 for their administrative fees over the course of the study. What we are suggesting the benefits to the physicians are, first, to actively watch their patients' estrogen metabolism be improved through the taking of the urinary baseline tests and ongoing physician visits, and monitoring the impact of the interventions. Physicians will feel more comfortable on prescribing estrogen-based medications. And again, physicians receive a 20% discount on the test should they decide to bill the patients directly for it. And we recommend that all women be tested, but there, as we'll review in a slide or two, probably 50% of OBGYN patients fit the critical criteria.
SNPs in this slide stands for single nucleotide polymorphisms, and when there are changes in someone's DNA associated with a switch in one or more of the nucleotides associated with DNA, A, C, T, and G, one of these SNPs can confer little additional risk, but when they are combined with many different genes that are associated with estrogen metabolism, the cancer risk can go up to as high as 13-fold. So one of the things that we try to do in our sample report is to provide the physicians as much information as they possibly need in order to make judgment calls about what the next steps might be in helping this woman deal with her estrogen metabolism. As you can see, we have the gene allele listed in the first column. In the second, we have the patient's genotype and phenotype, and then the results, so that the physician can get a quick summary of what these genes are doing and what their activity of these enzymes that are associated and being encoded by these genes represent. The sample summary report will highlight the dietary protocols that are recommended, and we have references for the physician so that he or she can go back to the literature and uncover the reasons why we're recommending these particular dietary supplements and protocols. We also encourage the practitioner to recommend lifestyle changes that are associated with some of these SNPs on either the phase 1 or phase 2 genes. And last but not least, which we pride ourselves in, is to be able to identify through some biomarker tests what these levels of estrogen metabolites are doing. And we also can encourage the practitioner to look at the serum antioxidant reserves using some of the standard tests through reference laboratories. I get this question all the time: who should be tested to reduce their risk for breast cancer? We believe that all women should be tested, just so that they know that whether they're in a low-risk category or a high-risk category. But there are 5 categories that are probably a priority. Those women who are taking any form of exogenous sources of estradiol, progesterone, or testosterone, such as oral contraceptives, hormone replacement therapy, or bioidenticals. Women who are considering in vitro fertilization. And the last category is to prevent the recurrence of ER-positive breast cancer in women who have been diagnosed with this particular condition. We know that estrogen exposure is an independent risk factor based on the Women's Health Initiative study in 2002. We want physicians to be able to pinpoint those patients that are at greater risk using the estrogen gene test, or who are taking estrogen-based medications and may need some tweaking to find out if they need additional dietary support in making sure that these estrogen molecules are excreted quickly out of the body. We know that 5% of the women taking HRT develop breast cancer, but wouldn't it be nice to identify those women in advance as to who are at risk? And that's what the EstroGene test does. We also can help that practitioner follow up with these women using the estrogen metabolite testing. This clinical algorithm purely states that it doesn't matter when you do the estrogen gene test, whether it's prior to starting estrogen, during, or after estrogen treatment. And the thing that we want to impress upon practitioners is that it's imperative that you do a before and after estrogen gene metabolism test so that you are identifying whether the interventions specifically recommended by the nutrigenomic panels are actually working. This is just a quick overview of the study that I've been conducting over the last 10 years. The first category are women who have not been diagnosed with ER-positive breast cancer, and the goal here is to prevent the disease. There are 3 categories of women. Of the 250 that we're looking at, 120 are premenopausal, and then 130 in the perimenopausal or postmenopausal. In each category, these women have SNPs on one or more of the following genes, and this also is applicable to women who have already been diagnosed with ER-positive breast cancer, and there are 75 postmenopausal women in this study group. This completes part 1 of the cumulative estrogen exposure and how to reduce breast cancer risk using genomic and physiological data. We're happy that you joined us, and we look forward to speaking with you